blood flow is crucial. So blood flow starts slowing down, just like in aging, from the time we turn 25. That's around that age when things start slowing down. So if you look at even a person's skin at that age, it looks great. But if you look at it with maybe a magnifying glass, you may see small fine lines, which if untreated turns into bigger lines. So aging that takes place because blood flow slows down. We start to get older.
Welcome to another episode of the Matter Over Mind Experience. I'm your host, Master Trainer, and Weight Management Expert, Narado Zico Powell. I have my good Jamaican friend on the show today. Man, I got a treat for you. I have a beautiful Lana Kerr. I'm told we're going to talk about the skin today, and we're going to talk about vaginal flow. We're going to talk about some wonderful stuff. And you look at this woman, and I'm telling you, her skin just glows. So we have a lot of stuff to talk about. See, Lana, she discovered like a new way to deliver carbon dioxide through the skin by using a gel. They call it like CO2 lift because it's great for skin rejuvenation. See, Lana's primary goal is to educate women about their bodies and treatment options they have. But we're also going to talk about menopause because that's when things tend to take a turn sometimes, right? So she's going to talk about how menopause can bring like a multitude of symptoms that can seem overwhelming, but advancements in treatments and vaginal rejuvenation are both state of the art and safe. So we have some wonderful topics that we're going to cover in this episode today, and we're going to have some discount codes for you too. So let's get this puppy started. Lana, welcome to the show.
Zico, nice to have you. Nice to be talking to a fellow Jamaican.
I know, right? I know, right? We're gonna start talking all kinds of stuff. People won't even know what we're saying. So, but stick through it. It's still gonna be good. I'm telling you, you're gonna love it. You're gonna love it. You might hear me burst out into song at some point. But with that being said, let's get right into this puppy, right? So we're talking about decreased vaginal flow on women's health. So what are the impacts?
Okay, I think first of all, Zico, I think it's important to, and I'm so glad we're having this conversation. And it's interesting because as a man, talking out to to a guy on this, it's going to be fun. I think what's important, first of all, is to identify what are the areas, the whole anatomy that we're talking about, right? So most women, in fact, I don't think I didn't look at my own vulva until I was in my mid 30s. So we're talking about the vulva and the vagina. So when you look down, most people just call that area the vagina, but really it's the vulva. So the vulva has five parts. You have the vaginal opening, which is what when you're having intercourse. You have the labia majora, then you have, which are the lips that cover the vaginal opening. You have the labia minora, and then you have the clitoris that most people see as that. They see really just a tip of the iceberg because the clitoris, most of it is under the vulva. So it's that's what we're talking about today. And when we think of the clitoris, it's when we're born, man and boy and girl, we're all born with a clitoris, right? And when it's a boy, that clitoris protrudes outside the abdomen and turns into a penis. Well, for a woman, it stays inside. So that whole erectile tissue is about the same size as a penis. And we all know how you guys feel about your penis, right? So most women, we just don't understand the benefit of the clitoris and what the function is, which is really created for pure pleasure. So that's the whole area right there. And then when we're talking about going forward, like you wouldn't have sex with a flaccid penis. It's not going to feel good, right? So it's the same thing for a lot of women have sex with a flaccid clitoris because they don't allow enough blood flow or they're not getting enough blood flow. So that's what we're talking about today. And so to go back to your question now, which was again,
Vaginal flow and the impact on men's health.
okay, so
I
basically
said
we're
women's
talking
health,
about,
not men's health. I apologize. Women's
and it's
health.
going to affect the men too, because if they're not getting any of that, they're not going to feel good either.
All right, exactly, exactly. It goes both
With the
ways.
health of the relationship. But yeah, blood flow is so important for that area, the clitoris. Just like with the penis, if you're not getting enough blood flow, you're not going to get an erection. Well, women need blood flow not only for sexual satisfaction, but just for general vulva vaginal health, right? So blood flow, what impacts on the blood flow? Aging impacts on blood flow. Stress, in fact, impacts on blood flow. When a woman gets cancer, it impacts on blood flow. And of course, aging, which leads to menopause, impacts on blood flow. And we that is necessary and important to think about because that's aging, and the impact on that is going to be less enjoyment during sex. It's going to be our lubrication, so we will have drier vaginal tissue. So sex is not as pleasurable, and it can become painful. Then we can get, because of that, and the tissue, it becomes atrophy sets in. Then we could get, it leads to infections. So I think it's, we as women really need to consider more than just the skin on our face and our neck. We don't talk a lot about vulvovaginal skin, and we can talk about why that could be so. I mean, the cultures are this, there's a lot of shame involved in for a woman, but really, blood flow is crucial. So blood flow starts slowing down, just like in aging, from the time we turn 25. That's around that age when things start slowing down. So if you look at even a person's skin at that age, it looks great. But if you look at it with maybe a magnifying glass, you may see small fine lines, which if untreated turns into bigger lines. So aging, that takes place because blood flow slows down. We start to get older. And just like how now we start taking care of our skin, if we don't take care of that area, I've heard a gynecologist say that a woman's true age, you can see it by looking in her vagina, because that skin is like the skin under our eyes. It's very thin. You usually see age first under the eyes, and that's how thin vulvovaginal skin. So if you're not getting regular blood flow, what's going to happen? That skin is going to become drier and thinner. And so even so the sensation will go, and then also too, it feels loose because it gets thinner as it's not thick and can grip and all of that good stuff. So that's the impact of poor blood flow to that area. And if it's untreated, or if we don't look at it, it's eventually going to catch up where all those different results that I just described is going to happen. So whether if you could be in, it could, just like aging, some women look older long they look older for younger. So some women in their 30s may look older than someone in their 40s, but eventually everyone gets old. That area is aging too, and the results of that is going to impact any woman if they don't treat it.
So somebody listening to this would say, "Wow, that sounds scary, right?" But then when we're talking about blood flow, because you're the expert here in this topic, what exactly are we really talking about here?
We're talking about just our vessels being engorged with blood, nourishing that area. So, okay, let me just give another example so you can think about it. So, you think about, say, a diabetic. I don't know if you know anybody with diabetes, and they may have an ulcer on their extremities, and it's not healing. Why is it not healing? It's because of their condition, circulation is impacted, right? They don't have good circulation, and then their blood flow slows down, so that can't heal, because you need blood flow to heal. Like, you need oxygen, which is in the blood, to heal things. So I know we're going to talk about a solution, the CO2, the carboxy. Carboxy brings blood flow. It can, in fact, we have done clinical studies. It can close a non-healing wound in as little as 8 days. So think about why that is happening is because once you put carbon dioxide into the skin, which will go into the tissue, it triggers a series of events that result in fast healing. I'll give you another example. Maybe this, as a man, you'll relate. Erections. You need blood flow, right? If you're not getting, and as some men have erectile dysfunction, so the blood isn't flowing there. In fact, one treatment that physicians are using is the CO2 lift. They're using it on the penis, on the erectile tissue, on the shaft, on the testicles. And if they do a series of 5, not only will you have smoother skin, but you're going to have stronger erections. There's a score called a shim score, which measures sexual function. And using the CO2 lift can increase the shim score 5 to 12 points. So if someone was experiencing mild to moderate ED, by using it for 5 nights in a row, Now they will have to repeat it within 6 months. They will not have that situation. That's blood flow. So that's what we're talking about.
And I gotta say this: I'm glad I don't need CO2 lift because I have enough problems as it is.
Not right now, not right now. But and even I mean, in that subject, and I think that's the issue that women, a lot of women will say that, I don't have a problem, meaning that, oh, I don't, I'm good down there. Well, not. It's not an indication of who you are, and eventually, Zico, you may have issues down there. You hear men will take, for instance, Viagra in their 40s recreationally, but by the time they reach into their late 50s, 60s, 70s, then maybe they really need it. You know what I'm saying? So you don't have a problem right now. But what a lot of guys need to do is make sure that blood flow stays healthy. And there are ways that you can do it. But we're not here talking about guys right now, but certainly for women, that is a fact of life. I mean, you go into older women, I mean, and I talk about, and it doesn't have to be older, like I'm going to be 53, so I guess I'm considered an older woman. But when we're talking about, even there are women in their 30s and their 40s who are experiencing, lack of sensitivity or maybe even lubrication issues, because the things that affect blood flow and that sort of thing is not only aging. I mean, you can have stress, you can have medications that affect it. Someone who is on an antidepressant can be affected by that. Someone who is taking even sinus medication. You think what sinus medication does? Sinus medication dries up your nasal passage, right? Well, guess what? Other passage is drying up. That's another passage, another mucous membrane that is going to be dried up. So she may have a drier vagina. So sex may not be as pleasurable. So this is a solution for all different ages. You see what I'm saying? So it's not necessarily a problem, but it's just that's life. And
Right.
we have technology, fortunately, that keeps that from a, can delay it, right? And even just avoid it altogether.
So, like, we're saying in Jamaica, you can't just drink roots all the time and think it's gonna take care of the problem itself, right? So, we need some blood flow down there. We need some blood flow. Um,
Yes,
if I doesn't get that, that's a Jamaican thing, by the way. But yeah, Google it. I'm telling you, Google it. Now,
that's
next topic, I want to talk about menopause, right? Because we know
okay.
that's a biggie for a lot of women. I mean, they hit it and things just kind of start going downhill at that point. So, what are some of the healing modalities you would say that are available to women who are going through menopause or even postmenopausal?
Okay. So menopause is a time when your hormones change, right? So you have less progesterone, estrogen, testosterone. So you have different symptoms. They've called the situation genitory GSM, genitory syndrome of menopause. Genitory syndrome of menopause. GSM, why am I blanking out? But it's a situation where their symptoms would include, you can have drier vaginas, painful sex. People go through things like hot flashes. People go through mood change. I mean, it's your hormones really affect everything about you, right? And so I believe that, I believe, and for me, gone through I'm in menopause. I can tell you, I think it's a great period of life. Would I want to go back to being 40? No, I love my age. I love how I feel because you feel as I've the experience, but then also I've used technology to keep me functioning youthfully, right? So in menopause, women can expect those various things. I really encourage women to think about even starting measuring their hormones from the time they're 35. Measure and get a baseline. Guys are on hormonal therapy. My husband takes testosterone right now. I mean, you may not have that situation right now, but the point is, I think everyone needs to keep up on their hormones, and there are bioidentical hormones that you can use. There's testosterone pellets, there's testosterone injections, etc. So to me, there are three facets in what I deal with in terms of the sexual function, which I feel is important to quality of life for a woman, that she needs to consider when she's thinking about going into menopause and in menopause. So one is a physiological aspect, which is really just what we described. How can you reverse those symptoms when you take something that increases blood flow, that's thickening the lining of the vaginal lining, that's going to help you with coughing and not peeing? All those things are maybe a sign of atrophy. You can address it. And I know we're going to talk about the different therapies that can do that. The other one is hormonal that we just addressed. Definitely checking your hormones out. And bioidenticals are safe. They basically metabolize well in the body, and It's going to make you feel good. And then the third really goes towards your podcast, the way we think. The biggest, even our sex organ is our brain, right? How we think about um, sex and how the importance of it. So, oftentimes women go through menopause and after that area of their life they're just like they're not interested as much in it interested in much. But if we understand the benefit of orgasmic sex to a woman, that is going to give you it's going to give you emotionally, it's going to make you more patient, it's going to increase your immune system. It's oxytocin that is produced during that whole exercise is really healthy for you. So first of all, if we the sexual energy, which is important. I mean, we're not in menopause, we're not creating a child anymore, right? We're not birthing, which is a miracle, but we're birthing ideas. We can use that sexual energy for other things. So if we understand those three things, that's going to help us to go through menopause with the right attitude. Then we have the right technology to help to reverse some of those symptoms, or many of the symptoms that we feel, so that we can feel confident. Going into menopause can be a wonderful, wonderful level of life, or a wonderful stage of life.
Wow, that's powerful. And it's from as you see, I'm doing a lot of like sitting back and listening in this episode because as a man, I can only say so much. I can only say so much, right? And yeah, and so for women who are going through that state of menopause, at that point, what would you like? What do you have any before we even get into the techniques, like any advice you would give them even before they start making any changes?
Yeah. Well, you're a big health guy. I mean, we want to, some of the things that we want to maintain is definitely exercising. We talk, strength training, the importance of strength training, the importance of flexibility, so stretching, the importance of cardio, all those things. Being healthy, going through any area of our life is going to make it better, right? So I really encourage women in their 30s, as they're usually busy raising children, not to neglect themselves. Not to neglect themselves, because when you keep yourself healthy physically and emotionally and mentally, we're going to go approach menopause when our children are raised in a different with a different outlook, right? The hormone testing, which is important, taking care of the skin on our face is important, but even more our intimate skin. I like to say that we don't get old, we dry up. So you think about a grape. We're all born this beautiful grape. Our skin is so plump and smooth and, you know, flawless. And then we turn into this raisin. And a raisin is nothing but a dehydrated grape, right? So it's lost its water content. So we need to keep not only hydration, drinking water is important, but we need to hydrate our skin. And there are things that do it. And one is that, in fact, the greatest way to do it is the CO2 lift. There's no other clinically proven way that hydrates your skin over 117% after one application. I look better in my 50s than I did in my 30s, simply because of the fact that I keep my skin hydrated, and not as much as I'm a big water drinker. And I believe in a gallon a day. That's kind of my motto. But it's not that for our skin, right? To feel, we need something that's going to hydrate our skin. So I tell women, take time for yourself. We always hear, put the mask on ourselves before we put on others. So then when you do all of that, then, and you're aware of what's going on in your bodies, because we are the best one to kind of understand what's happening and understand that this can help with that aspect of each system in our body. Once we do that, we also want to be mindful of for women, our vulva vaginal skin. It's super important. I always say our face gets our partner, but this keeps our partner, right? So intimacy is super important for connection, but not only connection with your partner, but connection with yourself. So you understand that you're raising the children, you're having your business, still find time to focus on yourself with the exercise and all the things that we were just describing, so that when you start going into perimenopause, when things change, then you can be ahead of the curve. You don't have to be behind by jumping ahead, testing your hormones, thinking about hormone replacement therapy, thinking about vulvovaginal skin, all of these things, so that when we're in it, we don't face those symptoms in the same way.
I love that, and the theme that I'm getting from everything here is staying ahead of the game, staying ahead of the curve. Oftentimes I've had conversation with others, and I'll explain to them that you don't wait until something happens. Like even in the case of, let's say, weight management, right? When I say, most people who are overweight, if not everyone, is at least insulin resistant. But the doctor doesn't do anything until you're type 2 diabetic. And then they put you on insulin and you're behind the curve. Then you try to work out. Then you try to do all these things. And at that point, is it reversible? Yes, but it's extremely difficult. Versus if you were taking care of it through your entire life, you would not be behind the eight ball. And once you're behind the eight ball, it's difficult. And that's with any aspect of your life. You have to do that. And the reason why I asked the question about things that we could do is because I want to talk about also lowering stress. I want to talk about taking time for yourself. I want to talk about drinking more water. I want to talk about the stretching. I want to talk about the exercise. It's not just about saying, hey, take this and this is going to be great for you, which I know is a fantastic product. But there are other things that you have to do, and you have to take that responsibility yourself. Male, female, whoever you are, you have to make sure, because that's extremely important. With that being said, we got a couple more banging questions I'm gonna ask. We're gonna get more into CO2 lift. We're gonna start talking about some really good um, techniques and things that we can give you to get when you come away from this episode. But before I do that, your boy gotta pay some bills because you love this podcast. Everybody loves this podcast, all right? So I gotta pay some bills so I can hang around. So let me tell you about one of my favorite companies, the Amino Co. Of course, I'm gonna talk about Amino Co. And today I'm gonna talk about Heal, right? Heal is 100% science-backed essential amino acid formulation designed to reduce recovery times and improve physical function by accelerating muscle repair by helping you maintain a healthy inflammatory response. Why is that important? Every time I do that ad, I always like to stop there because that's important because people or some people don't understand that when you train, your body creates inflammation. That's why you get sore and tired and all these things, right? That's part of the process. But because Heal has essential aminos, a particular blend of essential aminos and creatine, and by the way, I always tell people, so if I put a gun to my head and say, don't any supplement, you can only have one supplement for working out. Creatine is what I'm taking. I never understand why we have BCAs or EAAs and it doesn't have creatine. It just doesn't make sense. So you want to have your creatine, and it has whey protein concentrate. Put it together, it's amazing for your body. There are a couple ways to use it. My favorite way to use it is drink it in between, like an intro workout in the middle of my workouts. Everybody knows when your boy train, he goes hard in the paint, right? So I need something like to get me through that next edge. So I love Heal. It's a fantastic product, and it's kind of like eating a chicken in the middle of my workout, but it's already broken down. My body doesn't have to digest it; it's pre-digested, right? So it pushes me through that next part of my workouts. I absolutely love it. In fact, it was initially made for NASA astronauts so they can maintain muscle mass in space because Dr. Robert Wolf put Heal together with a particular blend of essential aminos with the creatine and whey protein concentrate that he tested and knew that will work well together for your body. And then they reformulated it for regular people like myself, even though half the time I don't consider myself a regular person. But it is what it is. I'm not an astronaut. I'm not an astronaut, so I put it that way. So I absolutely love Heal. There was actually a research where the net balanced whole protein synthesis and breakdown were measured against whey protein, and the response to Heal was found to be 3 times larger than whey protein on a gram to gram basis. Think about that, because first of all, a lot of times, depend with whey protein, you don't know what you're getting, and also a lot of times we have a hard time digesting it. But and I'm not saying I don't drink whey. I definitely drink whey protein as well. But in my workouts, I love essential meat. I love Heal because of how it's put together. And I so check it out. The website is theminoco.com/Zico Health, which gives you a 30% discount. Imagine that. 30% discount and a benefit because when you click on the website, you see this handsome face just looking at you. So there you go, right? So the website is going to be in the description of the podcast. You click on it, you learn more about Heal, see my beautiful smile, and get your 30% discount. But enough about me, enough about Heal, because now we're going to pivot back to my wonderful, beautiful guest, Lana. So, Lana, let's talk about making informed decisions about choosing the right treatment. So how can women make informed decisions for choosing the right rejuvenation treatments for them?
Okay, so let's define what we're talking about specifically vulva vaginal rejuvenation, right? When people think of that, typically you're thinking about surgery. That's what people would think about, maybe a labiaplasty where they're going to fix for aesthetic reasons, or maybe it's something that is affecting their health or their performance in sexual performance in one way. They may do opt for labiaplasty, right? We're not talking about that. There are non-invasive vaginal rejuvenation, or I like to call it vaginal restoration, and vulva vaginal, because remember, we're not just talking about the vagina, we're talking about the vulva. So the options that were available before the CO2 Lift V came in, because that's something that we had a soft launch in 2019, that the clinical studies were published in 2020, and now we're actually on doing another clinical study that is an IRB that will be completed by the end of this year, where we added stress incontinence. Women were evaluating that, and we do double blind studies. Before we get into that option, what were the options available? Well, you would go in, and if you had the conversation with your physician, your doctor may recommend a laser or radio frequency device, right? Where you're going in, and it is controlled damage to the tissue. So you may go in, put your feet up, they put a probe in, and they use either laser or radio frequency, and it's controlled damage to the tissue to elicit a healing response. And women would use that, and it can help. The CO2 Lift V, and I'll kind of go back into even my own experience, how we thought about this, because the carboxy for the face, which is really used by a lot of dermatologists and plastic surgeon, because I remember we talked about it's fast. Think of it as a hyperbaric oxygen therapy, but a topical, right? So they would use it to heal the skin, to treat issues with like rosacea, psoriasis, eczema, things like that. Well, when I was in my late 40s, I started experiencing a difference in the quality of my own sexual experience. So I had the conversation with my physician, and what she told me is pretty much what I described to you, what happens to that skin as we age. So she recommended a device that would go into her office, the same thing, a laser device. I made the appointment to do it, but on leaving, I was thinking we already have something that works very similar to energy based devices, because carboxytherapy is the therapeutic use of CO2 gas. Once you put it into the skin, you're not damaging the tissue, but it's going to elicit a healing response because of the introduction of CO2. So I'm like, it's building blood flow, it's increasing the tissue, the health of the tissue. Why wouldn't this work? So went to one of our advisors, our clinical advisors on our advisory board, who was a cosmetic gynecologist, and just talked to him about what he thought. And so we did a test, a proof of concept, where it was blind study, a double blind study. So that means the patients didn't know if they were going to receive our CO2 technology or an ultrasound gel, which was a placebo. And then, of course, the investigators are looking at the biopsies and the questionnaires, and they're blind to what they were actually using as well. The women that used the ultrasound technology showed no changes in sexual function. The women that used the CO2 lift showed significant changes in orgasm, in lubrication, in arousal. Um, and that's interesting because, you think that even the placebo would make some kind of change. It had no effect. Then we did the biopsies. And when we looked at that tissue of these women that were treated for 10 days, and then they did the biopsies 10 days later, that tissue, like those women were in their 30s. And these women were severely, they had a lot of atrophy going on. They were in their late 60s and 70s. And 10 treatments later, that tissue looked healthy, vibrant, youthful tissue. So, of course, pretty excited. In fact, before we even launched, and then we replicated the study with a larger subset of women. But before that, even I gave some to my mom, who was in her 70s, and my aunts. And, they went from sandpaper, which is what a woman will experience if she does nothing, to butter. So I was pretty excited about that. I'm like, yes, we have something. And it really does change your life. So that's an option. It's pain free. It's a gel. When mixed together, it's applied similar to tampon, and then right on the vulva. You leave it on for 45 minutes or go to bed with it. Wake up in the morning. You pee, your muscles relax, and the gel falls out. You may need to wear a panty liner just for the day so that anything, will mess up anything, and you're good to go. There's no downtime. It's hormone free. And women see results very quickly. As I said, in 10 treatments, you change that, recondition that vulvovaginal skin. To maintain those results, you'll want to do it once a month, and that's it.
Well, I see. What I like is that it's non-invasive, so that's important.
Mhm.
It's very easy to use, and you don't have to do it all the time. Once you completed, I think you said the 10 days, right? And then
Correct.
after that you only have to do it once a month. So it's not like it's gonna take up a very big part of your life either, and you can do it while you, like I said, you apply it, you go to sleep, you get in the morning, you take, you get rid of the rest, right? And then and then do for 10 days, and then once a month after that. So I love it, and I didn't talk enough about the CO2 part of it because that's extremely important. We know the importance of blood flow, and we know the importance that CO2 plays in it when it comes, like you said, when it comes to our skin, when it comes to our overall health, when it comes to our red blood cells, like we know the importance of that together. So this is not even necessarily saying it's a new thing. It's more of
Right.
knowing how to put it together and having the experience and working with individuals who need it. I mean, you also brought up the importance of bioidentical hormones. That's the important word, bioidentical. A lot of people don't
Mhm.
realize that, right? So, because it mimics essentially the hormones that's in your body, basically look exactly like it. So, and that's why it ends up being safe. So Lana is bringing up a lot of good things, and she has a lot of expertise. And just look at her. I mean, just look at the woman, right? And you will see how amazing she looks. So what she's talking about is science, and it definitely works. And I want to mention something before I ask her the last question, because I forgot to say we're gonna work on a discount code. By the time this episode comes out, the code is gonna be Zico15, and I'll put it in the show notes as well, so you can get a 15% discount off her products as well. Which leads me to one of my last questions, because I really want to discuss this. Let's talk about the overall landscape now, right? Of vaginal rejuvenation. So where does CO2 lift fit in that?
So I just was outlined to you it's not a lot of options that are there. I mean, we talk about either laser, radio frequency, and now, some people they may use HA, hyaluronic acid gels, which to me, I mean, those molecules are so big. It's more to me like an expensive lube. So when I think of options, I'm thinking of the laser, radio frequency, and now carboxytherapy. And so I feel that that is the most comprehensive way, because really you're doing it in the privacy of your home. You kind of managing your own treatments towards it. And it's something that it's safe. Not that the other treatments aren't safe, but there are complications that can happen. There is some downtime depending on which device you're using. You're not going to have that issue with the CO2 lift. So that's what I love about it. And it's something that a woman can start from, women in their 30s. If I had a daughter, and I have two boys, I would tell her to start, just like when you look at Asian skin and people are like, oh, those Asians, they look good for a long time. Why? Is because they start skincare from their 15. Before that even impacts, we talk about preventative, right? Same way, I would want a woman in her late 20s to start considering that area. She may not need to do 10. She may need to do a loading dose of 5. And then it's just once, maybe once every quarter, because it's just to keep it, you want to keep it at a simmer. And you want to keep that blood flow at a simmer. You may not be sexually active, but you want to keep it at a simmer. So when you turn up the heat, it's just ready to boil. You know what I'm saying? So it's kind of, that's what I would encourage, as well as the fact that it's a mind body connection. We as women, we have very few sexual cues. I always say a man can go and stand in the breeze and, he get an erection. But women, we're cerebral. We think about, we have so much on our head, and we need to, the act of taking care of that area is going to keep us focused on it. It's going to keep us, it's almost, it gives us a certain confidence. We feel sexy with taking care of it. And then so it's starting early. I love the option of the CO2 lift, a CO2 lift fee. But I also tell women just regularly to moisturize that area. And you want to use products that don't have scent. We have something on for those who like it, a oil. It's a, we call it the glow oil. You can use it on your face. I love to use it down there. It's a an oil just to keep that area conditioned. But again, the CO2 Levies is a treatment. So in my opinion, and obviously I'm maybe biased, but even just as a woman, what would I rather do? Sit in stirrups, get this treatment with the lights on. I don't even get a glass of wine with it, right? Or do something in the privacy of my home, that's healthy and it's going to keep me feeling zen and confident in all of the things we talked about.
Man, as she was talking, I heard that I don't know how many men are listening at this point, but what I heard is she's saying we think with one brain. I kind of heard that, so I'm just saying, I'm a little biased over here, being a little biased, but it's okay. It's okay. I'll let you get away with it. But I do want to say this though. Let's to tell the audience like more though, because about like what's your website, how can they get in touch with you if needed, stuff like that.
Yes,
This is your
okay.
time. This is your shameless plug time, Lana.
Okay. Well, first, I love talking about this. I mean, obviously, our this carboxy we have for the face and the body, it's incredible. It's something, and I believe in skincare. I believe this is the image that we put out into the world, But then we talk about quality of life, and we want to not forget our vulvovaginal skin. So I love talking about this. Feel free. My Instagram handle is the Lana Kerr, and if you DM me, I'm always willing to answer any questions. We have a support team at CO2 Lift and at CO2 Lift V. So we have those other two handles. And again, DM, our support team will get back to you. And then, our website is CO2 Lift. And as Zico said, when you check out, just use Zico 15 and you'll get 15% off the website. But again, if you just Google my name, I have a lot of talks and conversations, YouTube, you'll see a lot of conversations that other people are having on CO2 Lift fee and CO2 Lift.
Perfect. And of course, her information are going to be in the show notes because, I try to be a nice guy. I try to make your life a little easier, right? That's all we're trying to do here, make your life better and a little bit easier. So the show notes, and they're going to be zikahealth.com/CO2 lift V. I should add that
Mhm.
part to it. So it's going to be
Yes.
zika.com/CO2 lift V. But of course, the show
No, no,
notes are
no,
going
no.
to be.
Sorry. It's just CO2 Lift. CO2lift.com. And then when they're checking out, they just put in Zico 15.
That's right. That's why I wrote it down like that. See, thank you for reminding me. It is zikahealth.com/CO2 lift. Those will be the show notes. And
Yes.
to avoid, I'm sorry for the confusion, the show notes are going to be in the description of the podcast. So since I'm apparently I'm a man and I can't think with my right brain or the correct brain, but I'm going to say that you can click on the podcast or the description of the podcast and you can access all information about Lana and learn about her wonderful work. And with that being said, thank you for being here, Lana. Everybody, thank you for listening. Thank you for watching. Thank you for putting up with me. Enjoy the rest of your day, fam.
Thanks, Zico.